Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education, or IPE, is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration. Our guest today is Brad Chicoine, a board-certified critical care flight paramedic and registered nurse. Brad earned his associate and baccalaureate in science nursing degrees from Maine College of Health Professions and holds a Bachelor of Health Sciences from the University of Southern Maine. He has worked in public safety for 20 years as a police officer, firefighter, paramedic, and presidential medical aide for George H.W. Bush. When not treating patients as an ICU nurse or paramedic, he enjoys spending time with his wife Kelly, his kids Piper and Gage, dogs Tilly and Charlotte, and squeezing in time to referee high school basketball games. I am so excited to introduce Brad Chicoine. Brad, I'm so glad to see you here today. Susie and I are really glad that you could join us for this interview.
Thank you for having me.
Yeah, thank you so much, Brad. We're really looking forward to this. So to start off, can you just tell us a little bit about your background? Because nursing wasn't actually your first profession, so.
Yes, that's correct. So I started my career off in law enforcement. Ironically enough, I was a police officer for 5 years. Then I decided I wanted to branch out and become a paramedic firefighter. So I've been a full-time paramedic firefighter for 20 years. And then at age 40, I decided during my midlife crisis to go back to nursing school. And I'm so glad I did. Upon finishing nursing school, I went to a local hospital and worked in the intensive care unit. That's the reason why I went to nursing school. As well as right before I started nursing school, ironically, I was a presidential medical aide for George H.W. Bush. That experience is what actually turned me on to go into nursing. I really enjoyed the palliative care and hospice experience that I had with him and his family. So yeah, that's kind of me in a nutshell.
Follow-up question. I noticed there's a huge difference between the intensive care type of work that you've done, right? Adrenaline junkie kind of thing, and hospice. How did you get from one to the other?
That's a great question. I never thought I would enjoy hospice as much as I do, but working in the intensive care unit and being able to bond with the families and realizing how much of a change we can make as nurses in that field really opened my eyes to that experience, and it's what my go-to is in the ICU. Anytime we have patients that are going to go CMO, I volunteer and take those cases because I love that continuity of care and that final transition piece of life that I think I can make a huge difference with. Where the rest of my career has always been keep them alive at all costs, especially as a paramedic, that's kind of my goal. And to actually, maybe it's a maturity piece. Now that I'm older and more experienced, I actually enjoy the other end of the final piece, where it's kind of where we've all got on the same page. It's time to make people comfortable, and then that's when I get a chance to do my best work.
Fantastic. So I just want to, for clarity's sake, CMO, you mean comfort measures only, right? For folks who may not be familiar with that acronym. Great. So what are you doing now? What's right now what's the focus of your work, or are you still doing multiple things?
Still doing multiple things. I still work as a full-time paramedic firefighter. I work per diem as an intensive care nurse. I've also been cross-trained in the ER as well as a clinical resource nurse with my paramedic background. So that's kind of a fun job to do in the hospital, where you're just kind of a jack of all trades and kind of go on everything in the hospital. And then I also work as a pediatric nurse at Camp Sunshine in Casco, Maine, for terminally ill cancer children.
You graduated, was it last year? So a year ago? Or has it been 2 years?
2023. It'll be 2 years, like pretty much now. So yeah, 2 years now.
Okay, it doesn't feel like it's been that long. So can you talk about kind of how your IPE and what you had at college, how that prepared you then for going in the future, what that was like for you during your time there?
Yeah, so IPE was new to me and never really heard of the lingo or the terminology. So I was open-minded, decided I'd give it a whirl, and I really enjoyed it. I didn't realize the difference of opinions that gets brought to the table. Again, I'm usually public safety driven, so to actually walk into a nursing world and realize I'm going to work with a bunch of other disciplines was eye-opening to me. And a lot of times I feel like in nursing, I was just kind of making sure the flow kept going. If I was a very aggressive nurse, then a lot of stuff could happen to my patient during the day. But if I wasn't as aggressive, as some of my colleagues may not be as aggressive as I am, care seemed to slow. So I learned through the IP experience that getting those different perspectives at the right time is what actually helped the outcome of my patients to be better than most, I think.
So, and I recognize that I'm the one that facilitated and organized your IPE. So I'm putting you in a bit of a spot here. Were there any specific moments of your IPE that stand out to you even now after all this time that you felt were particularly impactful or really helped you prepare for the work that you're doing now?
Probably the experience at the art gallery, which is ironic because I'm colorblind. So when I would look at a picture, I see not a whole lot of detail to it. And then to have other folks in my class look at that same painting and get completely different perspective was eye-opening to me, because looking at my patient as a nurse, I see it from one angle, and then to have those other disciplines come in, they see it from another. So that was one of those experiences that directly relates to my nursing career.
Right. And just so for people who may be listening or watching, you're referring to something called visual thinking strategies, and that's something that we did as a standalone session, but we've also done it embedded within other sessions, I think, several times. So that's great feedback. Thank you.
So during your time, the 2 years that you were studying to be a nurse, you had various IPE sessions. I was with some of the ones where you were there and it was facilitated, and you're a very active participant. Were you like that in all of your classes? Did you just kind of a person that's like always just going to be, I'm going to be engaged and I'm going to be doing this? Or was that a choice, or was it something about the IPE sessions that made it different?
I think it's a mixture of both. I'm a very A-type personality, being a former police officer and work in public safety, so I'm not overly bashful. I'm not shy, and I always want to know. So being engaged is something I've always done. I've always been that kid in school that sat in the front of the class, still took notes on everything, and just go back and reiterate my learning. And I think IPE gave me that opportunity to do the same exact thing. Because now I had different specialties and other instructors there that I could pick their brains, and I was super eager to do so.
Did it matter to you? Because I think sometimes IPE sort of gets a bit slated as, oh, these are soft skills that you're learning. And that's just kind of extra fluffy stuff and things. Is that how it came across to you? I mean, being type A and being very like results driven, were you able to look past that, or what triggered that for you?
Absolutely. I don't think it was soft skills at all. I think it's the foundation of nursing. If you can't talk to your patients and families, how effective are you going to be? And IPE really pushed me outside my comfort zone to ask those difficult questions and interact with those different disciplines in ways that I never thought I'd have to.
So just sort of building on that, I'm thinking about your work caring for people who are dying and how important. Those are difficult discussions. I mean, those are just really hard discussions. And so I think it's exciting to me to hear that you maybe drew from certainly your previous professions, but also some of the IPE that you did to be prepared to have those difficult conversations, to have interprofessional, because boy, if anything should be interprofessional, it should be care of the dying, right? People who are dying. So to think about it that way, that's a new way for me to think about what some of the outcomes or some of the skills that people can gain through IPE and where that could end up influencing their work. So that's really an interesting perspective. Thank you. So thinking about transitioning to the workplace, how is that transition for you from coming from a place of, IPE at this institution where you attended is, it's a core thing that we do, it's required. And transitioning into practice. Can you talk to us a little bit about what that's been like for you?
So initially it was a struggle because I definitely learned that it's not universal across all nursing programs. Kudos to MCHB. You can tell those of us who came from that IPE-based program, because we were very upfront with the physicians we deal with and the families, and a lot of other colleagues of ours were like, wow, you guys aren't afraid at all to ask the difficult questions and have those conversations. And I think a lot of us referred it back to the IPE experience. So once we got over that hump and we started almost setting the stage, a lot of our colleagues jumped on board and they also felt more comfortable. And I think a lot of it may have been a little bit deceiving with my age and being a new grad with my background, that I don't think a lot of folks anticipated a new grad to be as vocal as I was. I was a huge advocate for my patients and I always will be. But IPE definitely was the driving force in my comfort with those conversations.
So it sounds to me like you didn't find initially that practice was like you had learned about in school, but that you were able to make a difference. I mean, it's been 2 years, so that's exciting to know that you'll be able to take those skills. Because there's a lot, Susie, I'm sure you could back this up. There's a lot in the literature and in discussions around IPE. Like, where is the direct connection between student experience and students' education, and what's the impact, or is it making an impact in patient care? So what I'm hearing from you is, yes, you felt better prepared, along with other colleagues who have interprofessional education experience, to do things a little bit differently than maybe you initially encountered when you went into practice. I find that really exciting.
I think too, it also reiterates kind of what we talk about, how with the students, I know I always prep mine and say, you're going to go out into practice, and it's not always going to look like this, but you can make the change and you can drive it. It definitely helps, when you kind of go back and you're making a career change and you've got that confidence and that ability to say, oh no, I want to drive this forward because I know this is the best thing for my patient. And you can kind of take charge and be an advocate for them, which is amazing. Are there people though that you found that really kind of push back on your style? I know some people you've gotten them on board, but if people, or if you're trying to break down hierarchies and they're like, no, this is the way we've always done it.
Yeah, I think the more seasoned nurses that have been doing it a long time, that are very set in their ways, weren't as optimistic about that approach as the newer grads and the nursing students that we were precepting. That's what we're being trained to do now. So I think it's just a change in culture. So I definitely think, it was very much welcomed by nurse management because they kind of like to see that progression. And then we had to soften it a little bit with the senior nurses we work with, and kind of talk to them after the fact and kind of get them on board. And a lot of times now they just sit back and they smile when we do it because they know where we're coming from. So it's good. It's really good.
Well, good to hear.
You talked about some pushback, and that phrase that Susie said is probably one of my least favorite phrases in healthcare, and the way we've always done it. Did you find any other pushback, any other specific things that people said or that they did because it's scary, right? It's scary when you've been doing something, or scary is maybe the wrong word, but you've been doing something for so long and it's seemed to work well, to have someone come in and say, I think we can do something better and it looks very different. What other ways or approaches did you kind of encounter from people who are reluctant? And maybe how did you encourage them to see the benefit of IPE?
So I think initially breaking the ice was the first one. It's kind of the first step. And then if we weren't believers, or I still got pushback, then bringing evidence-based practice forward is helpful, from like nursing journals, or what other hospitals are doing, and kind of getting their perspective on why they may not agree or they don't see my perspective, and just having those critical conversations. It made a world of difference just sitting down and listening to their perspective and kind of building upon those IPE things that I learned, to be like, all right, so to me, it's very black and white, but to this discipline, it's a bit gray. Or the long-term intensivist has done it the same way every single time, and he or she has had really good results with the way that they do their treatments, and you offer another suggestion that might be a little bit more holistic, and they're like, it's like, let's just give it a try. It doesn't cost anything. Sometimes it works, and you kind of get them on board with a couple positive results, and then a lot of times during rounds or whatever, that conversation come back up again, and they actually may suggest to another nurse, why don't you give this a try, because I've seen it happen in the past. So it worked. And then you sit behind because it's not your patient anymore, and you smile because you know where it came from, but you kind of had to plant the seed and make it like it was their idea next time.
Changing culture. That's not easy, is it?
Not at all.
So I think I want to do a little bit of a shift and looking at so can you maybe tell a story or like a time collaboration between various different professionals? So you got doctors, nurses, social workers, and how you work together to really improve patient care.
So I'm going to lean on my end of life experiences, because I've had really good experiences in the hospital that I work at with that transition in that stage of the life. So when you listen to the family and they want one thing, and then you listen to the patient and they want another, and then you try to get these other specialties in on the same game plan, sometimes it takes time. But a lot of times patients don't have time. So sometimes making sure I don't violate policy. I just do the right thing. An example that I have to share was I had a gentleman that decided he no longer wanted all the resuscitation efforts and everything performed. He was tired. He was in his 80s, and he was a biker. So his last request was he wanted to see his biker gang one more time. So I arranged to have his biker club come behind the hospital. We shut down an entire road. I didn't run it by security, so I had to learn from that experience. But I was able to bring the patient outside with the permission of the hospice docs, the intensivist, respiratory therapy, the whole 9 yards, and he was able to say his final goodbyes to his biker gang. So to him, that was huge because he knew he probably wouldn't do it again. And he was like, that was pretty nice of you. And like the family was great. We got flowers and the whole 9 yards involved. It was a really good experience. But sometimes you think outside the box and then you might get a little bit of resistance, and then you explain why you did it, and they're like, you did all the right things, just maybe next time involve us a little bit more, as an example. So, lessons learned. But I made it work for the patient and the family, and it was a great experience. So it's kind of setting the bar high for other nurses to think outside the box.
Yeah, that's amazing. I think, and you wonder sometimes too, where people think, oh, well, that's just too much extra work, or I'm not going to bother with that. But that's like, that man's about to die, and
Right.
it's like a final wish, and you're granting that.
Right.
That's amazing.
It
Yeah.
didn't cost, just took time and a little bit of effort, and I didn't have lunch that day. I'm like, I'll do it on my lunch break. Let's just make this happen. And it worked.
Brad, in your experience, how do different professions approach patient care, and how do you manage those differing viewpoints or approaches? Especially, I'm thinking within the confines of maybe in an ICU situation where decisions are made quickly and action needs to happen pretty promptly.
So I write everything down. Like the players in the game, I write down. So if I'm dealing with social worker Sarah, I have her contact information, the intensivist information, the hospice nurse, whoever. And that way there I can kind of keep everything straight, because like you alluded to, everything moves really fast sometimes. And with technology, orders get updated and stuff gets changed around with a lot of times without the nurse even knowing until the next time you log in and say, oh, that changed. So in the one way I've been able to work with balancing all these different disciplines is just write everything down with kind of approximate times and try to make sure I reach out to the same people and not try to muddy the waters with other people of those disciplines. So find that contact person and just deal with them directly and just kind of stay in touch with them throughout the whole shift.
And when conflict or disagreements arise, especially around patient care, how have you found it's best to manage, cross disciplines and professions? Because that can be really challenging, can it? Because you've each got your own perspective, and you very much feel like you are the best advocate for the patient, but it could very times clash, with each other.
So a lot of listening. I grew up knowing my parents have always said you have 2 ears and 1 mouth for a reason. Listen. So do a lot of listening, and if I pitch something to someone and they don't buy into it right then and there, I at least planted the seed, and I might circle back and approach it from another angle and just kind of keep pecking away at it. And I've definitely found that the squeaky wheel typically gets the grease. So eventually they do end up getting on board, even though I may have to bend a little bit to kind of meet their needs as well and kind of what their goals of care are. But I haven't really found a whole lot of faults. As long as I advocate for the patient, everything else just kind of falls in line.
Have you taken then from your kind of some of your other career experience as well with that? If you found that really worked well, say when you were in the police or being a paramedic as well, because that's a really we're talking about emotional intelligence or whatever. I mean, that's a really important skill to develop, and you've obviously done it quite well, but it takes time.
I bounce all my different hats all the time in all different scenarios, and it works. Something that might have worked for me 20 years ago when I was a law enforcement officer may work really well for that super emotional, very aggressive, over-the-top family member that was just given the news that their loved one's going to die. It's all, to me, it all plays a role, and it all works well with each other. Just kind of pulling bits and pieces from different experiences that I've had.
So shifting gears a little bit here, Brad, in healthcare education, we tend to be very siloed, and that's part of what IPE is trying to sort of break down those silos or to broaden perspectives. So in what ways do you think that the IPE that you engaged in because you did it at the pre-licensure level, but also the baccalaureate level.
Right.
How did that help you develop your professional identity beyond nursing? Right. So you're a proud nurse. I'm a proud nurse. But to think of yourself as a interprofessional team member, how did IPE help you in that regard?
I think it forced me to slow down. It forced me to really take a deep breath, look at the big picture, and take everybody's perspective into consideration before doing anything. Not to the extent that I was paralyzed not to do anything, but really made me realize if I do X, Y is going to happen. It's going to affect that other discipline. So through IPE and my experiences, I was able to kind of mold myself to have a little bit broader shoulders and kind of prepare myself for what might happen next with the responses from those other folks.
This is around confidence. And I think, you come across quite confident in your ability and all that. But how is then working in an interprofessional team? How has that impacted your confidence, or maybe thinking about the team aspect a little bit differently, like in who you are as well with that?
I would say nursing has humbled me a lot. Working with other disciplines and realizing that there are way smarter people out there than me that I work with, which is wonderful. I like to be in a group where I'm not the smartest person in the group because I can always elevate myself with those around me. So that itself, humbling was probably the best way I can describe what my confidence has had to deal with in nursing. Being a non-traditional new grad nurse, there was a lot of assumptions. And then people would find out that I've only been a nurse for 6 months or 8 months or a year and a half because of the confidence because of my background. It was shocking to a lot of people. So just kind of staying humble and just saying thank you a lot and smiling made a huge difference. Try not to, brag about yourself or what you do. Just kind of, I don't know, humble. It's the best way I can just put it. Just continue to be humble.
Has that been hard? I think.
Yeah, I would say it's because in my other profession, being A-type personality, I run the show. Whether I control a scene of law enforcement or I take over the medical emergency as a paramedic, I don't have anybody to bounce any ideas off. It's me and just run with it. Where in nursing, you can advocate, but you just can't run with stuff. You need orders. I mean, you need buy-in from those physicians to be able to help your patient in the way that you deem necessary. So it's be able to take a step back and realize I just can't jump in and do it. I have to ask other people or elicit the feedback before I do something was a huge change for me in nursing. It really was.
Has that changed you in other aspects of your life?
I think it's kept me more open-minded and probably not as aggressive as I used to be 20 years ago. So I think a lot more. I think before I speak a lot more. I think before I act a lot more. And if I don't understand something, I just ask. I don't assume anything. I just ask. I ask a lot of questions.
Honestly, and I don't know about you, but I mean, just teaching IPE over the last, almost 10 years, that's changed me in the same way, completely. And I used to very much be like, I want to work alone. I want to do my thing. I know what I'm doing. I don't need anybody else. But now I'd say my life is so much more richer, being able to involve other people and getting their feedback. And it's like you learn all this stuff and you're able to grow and develop in ways you never thought.
Absolutely.
I'm kind of reflecting as you're talking about your process and staying humble and kind of growing. And I'm thinking growth mindset. You're a great example, I think, of someone who lives that, a growth mindset, willing to learn, staying curious, asking questions, right? One of the things in a recent IPE session I talked with students about was, managing how other people see you and being afraid to ask questions because you'll be perceived as not educated, not smart, not prepared, not right. And it can be really, really challenging to hang on to that growth mindset, that being prepared to stay curious or actively staying curious, being willing to ask questions. That's just really, I find that very impressive. And I think that that's a hallmark of a great healthcare professional across the team. Ones who are willing to stay in that growth mindset and ask the questions and be curious and to pull from others' perspectives, I think is really important. All right. So I have a question about lessons learned and recommendations. Are you ready? Okay. All right. So current students, what advice would you give current students who are preparing for IPE sessions in terms of making the most of their experience?
Don't take notes. Like, live in that experience.
Okay.
So I think some people, and sometimes I'm one of those folks that just takes down a bunch of notes. You just kind of get bits and pieces where, put the notebook aside, put the phone down, and just sit and listen and kind of take the whole experience in and look at people's facial expressions and how they ask certain questions and how they respond to them. To me, that if I could go back and do IPE over again, because I totally would, because I loved it, that's what I would do. I wouldn't take as many notes. I would just kind of sit back more and just be more engaged.
You're talking about presence.
Yeah, presence in the classroom, absolutely.
Great. That's great. Great feedback. Thank you.
Like, I need to tell that to my students at the start of the year. I'm like, yeah, I'm going to take down notes. Maybe a bit of criticism, but looking back on your IPE, is there anything that you wish that you learned more about that would have helped you in your current practice?
I wish I would have learned more about the other disciplines. Meaning, when class was over, talk to that resident doctor or that social worker. I might have had a few more questions that I didn't have time or I didn't have the courage to ask during IPE. I wish I would have sought them after class and asked a few more questions. That way there, I would have had that background before. I still ask the same questions now that I work beside them, but it would have been nice to kind of have that in my back pocket before I had some of the conversations I had to have in the hospital.
What do you think that it would have worked as a planned session where you're kind of we've thrown around ideas about almost like speed dating, where you kind of like go around and learn about the different professions and talk to somebody and doing it that way? Or do you think that's too forced, or what are your thoughts on that?
I think that's a great idea. That would be super fun. And I would have no issue being one of your folks that sat on one of those panels in whatever hat you wanted me to wear, because that would be awesome. Something like that's great because it's more of a one-on-one. Maybe some folks would feel more comfortable asking more detailed questions versus feeling like they'd be judged by the group if they asked what they deem to be a stupid question, and there's no stupid questions. So I think that's a great idea. But yeah, definitely more of that opportunity to talk to that discipline in a more isolated setting might be beneficial.
Love that. That's a great idea. Yeah, you heard it here first, folks. Future IPE session. So beyond that, beyond providing time, and I think that your point about folks being unwilling to ask questions to a larger group is very well made. Beyond that, is there something that you would encourage people who create, facilitate, host IPE? What do you want us to know to do a better job at helping folks who are about ready to become healthcare professionals?
Asking for what would you like to see us do for you in an IPE session? Like a survey of some sort, or just someone might have a whole lot of interest in, I don't know, psych medicine versus X-ray versus MRI, or that way they might be like, oh, I never thought about bringing in someone from the MRI world. Maybe I can get someone from that specialty to sit down, because maybe there's a nurse that has a really, wants some more insight on the MRI process or what their training is or what they have to do on that perspective versus what we were offered. I know we were in the infant stages of that program, my class, and I think that maybe the class before us, so you were still building on that program and nailed it. But maybe the opportunity to have other specialties brought in that the students want to see in there that maybe we didn't think of as a group.
That's a great point. Years ago, and it was before you were a student here, there was a nursing student who wanted to learn more about forensic nursing, and on her own reached out to the state and had someone come do a presentation off hours. It was pretty well attended, but that's a great idea to sort of ask for specific topic areas that we might be able to bring in for students. Yeah, thank you.
Okay, now we're coming to the part. This is Anne's.
I love this part of the interview. I do. Have you ever watched that show, Inside the Actor's Studio? Have you ever watched that, Brad? Oh my goodness.
I haven't either. I still haven't, and we've been doing this.
That's okay. You don't have to. It's not a requirement. So what they do is this these set of they're called pivot questions, and they're not particularly healthcare related, but we've found in interviews we've done they solicit some really they elicit not solicit, they elicit some really interesting responses and really thoughtful things that I think about well after the interview's done. So we're gonna ask you these questions. You're free to not answer them, say next. But here they are. You ready?
I am ready.
Okay. All right. What is one thing about your own healthcare profession you wish other team members knew? Or alternately, another way to think about it, what's the greatest misconception that others have about nursing?
That we can do everything in the time that we're given. I think our biggest fear as nurses is that we just run out of time and we just can't do what we want to do.
Well said.
So, my question, do you have a favorite medical word?
Probably analgesic. Only because I know it usually goes hand in hand with comfort.
What is a profession other than your own that you haven't already done that you would like to attempt?
I think it would be awesome to be a trainer of service dogs.
Ooh, yeah. You have dogs, right? You have 2 dogs?
I have dogs. I don't know if I would put my dogs through that training. But to get those, because the service dogs are in the hospital all the time, and those the big poodles or the golden retrievers, and it's just amazing how disciplined they are and how nice they are. I'm like, that would be such a fun job, is to train those dogs to either be deployed in the hospital or to patients. That would be awesome.
The opposite of that, is there another profession that you would definitely not want to do?
Be an artist. I don't know. It just doesn't do it for me. And maybe being colorblind, I just don't see the beauty in art as I should. But I don't know if I would do very well being a professional artist. No guarantees in that.
Yeah.
Pretty open-ended, isn't it?
There's really no right and wrong, I think, or like, yes, you've finished. It's very subjective, isn't it?
I think that would be hard too. Yeah, I think it would be hard. What is a sound or a noise that you love?
We all know the best sound is an ice cream truck, but ice cream truck, I really like it when they play that lullaby over PA when a baby's born in the hospital.
Oh,
it's such an awesome. Everybody smiles like, oh, the baby's born. It's so awesome.
It is.
Oh, that's great. They don't do that here.
They didn't do it when my kids were born, and I think I should get to go back and play it. One for each kid. Right in a row.
So when you were a kid, what's one career that you imagined doing or thought you were going to do?
I was going to be in the military. I wanted to be like an Army Ranger. Jump out of helicopters, do something exciting.
I must say I'm really glad you're a nurse. I'm really glad you're in healthcare.
I can thank my for that.
What?
Being colorblind is the reason why I'm not in the military for those professions. It rules you out immediately when you're colorblind.
I'll think of that. Yeah.
Didn't even realize that.
That we learned something new today. All right. Last question is, what is a book you're currently reading or one that you would recommend? I've gotten some great book recommendations asking this question. Love it.
I really enjoyed the book Gesundheit, the story of Patch Adams.
Okay. All right. I've not read that.
One of my favorite movies. It is awesome.
Great recommendation. Thank you.
You're welcome.
Thank you. And Brad, I think you probably have to know that's it. So thank you. I thank you so much, Brad, for meeting with us today and having the talk. It's been such a pleasure. And then for those that are listening, if you want to get in touch with Brad, we're going to put his contact details in the show notes so you can reach out to him directly.
Thank you.
Thanks, Brad.
Thank you so much, Brad.
Very much appreciate you making time to talk to us. And I will remember that you volunteered for the speed dating IPE activity. So we'll be talking.
That's what I was saying. Before we sign off, we want to remind you that whether you're a student, a practitioner, or educator, the work you do is important and can be stressful, but you're not alone. Please take care of yourself. Let's look out for each other, and we hope you join us again soon.
Thank you for tuning in to the iSpace podcast. If you enjoyed today's episode, please take a moment to like, subscribe, and share it with your friends. Your support helps us bring you more great content. Stay tuned for our next episode.